Hey there, Luis Moreno here with Simply Health Insurance Agency. Thank you so much for being on today's ACA Obamacare educational tutorial. Here's what I'm going to do. By the end of this video, guys, you all are going to have a good understanding of healthcare. You're going to know the basics of healthcare, and also you're going to know how to quote yourself and enroll in the best possible plan that works for you. And there's a lot that goes into it. So get ready, guys. I'm going to jump right into it. The first question that I get from a lot of my insureds is this: Luis, is ACA going to stay around? Are they going to take it away in the future? Okay. Am I going to have to decide on enrolling something else? So I get this question quite a bit, and I want to talk about this first. Then we'll get into more specifics on ACA and how to quote. But I'm going to share some numbers with you. Okay. So looking at this article here from Kaiser, check out the numbers, okay? As of early 2023, there's 18.2 million people enrolled in marketplace coverage. That's a lot of people enrolled with healthcare. Now, open enrollment started November the 1st of 2023 and ended January the 15th of 2024. People that enrolled during that time period have plans that started either on January the 1st of 2024 or February the 1st. But look at this crazy number here that's coming straight from CMS, Centers for Medicaid and Medicare Services. Look at this. 4.5 million people have enrolled in an ACA marketplace plan since November 21st. That is 3 weeks into the open enrollment. We still have the rest of November, all of December, and 2 weeks in January for this 4.5 million to increase. The reason I'm sharing this with you is that there's so many people enrolled in ACA that it's impossible just to flip the switch and turn it off. What is going to happen with all these people that are insured? The problem with ACA and trying to get rid of it, not that it's an ACA problem, but the problem of trying to get rid of it is if they do get rid of it, what are they going to implement in its place? That was the problem with this last administration. The last administration just wanted to get rid of Obamacare, but they had no solution on what they were going to do with all the people that were already enrolled. So nothing much happened. So guys, I want you guys to rest assured, do not worry about what's going to happen with ACA in the future. Okay, if anything does happen and there's a replacement, we'll handle it and we'll help you move to that replacement, or you'll be able to move to that replacement. But as of right now, guys, I am not seeing any replacements for ACA. It is here to stay. All right, guys, when we talk about enrolling in individual coverage, you're either going to enroll in the federal marketplace or you're going to enroll with a state-based exchange. It all depends on what state you live in. So I'm going to share this with you. Okay. Now, this is what healthcare.gov. This is the federal marketplace. There are 33 states that participate with the federal marketplace. Now, there are 19 states that do not participate in the federal marketplace. All right, let's take a look at those, because those are more important for you guys to know if you reside in one of those states. So if you live in California, you will enroll with Covered California. They have their own site, their own platform for you to quote and enroll. You will not use healthcare.gov. Okay. With Colorado, you'll use Connect for Health Colorado website. For Connecticut, you will use Access Health CT website. DC, you'll use Zerlink. Idaho, Kentucky, Maine, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, New Mexico, New York, Pennsylvania, Rhode Island, Vermont, Virginia, and Washington. So those states right there they utilize their own state-based exchange for you to get a quote and to enroll. They do not participate with the federal marketplace. Now, you've got three that have the state-based exchange, but they use the healthcare.gov platform. That is Arkansas, Georgia, and Oregon. And in 2025, Georgia will be their own state-based exchange, just like the others. So again, you got to know what platform you're going to use to run a quote and also enroll. In this section, we're going to talk about the 4 parts of a health insurance plan. Getting a good understanding of the way these 4 things work is crucial. You must know this. Without knowing this, you don't know if your plan is good or bad, and you're not going to know the specifics of your plan. And what it could lead up to down the road is some nasty financial surprises. So I'm going to share with you the 4 parts of a health insurance plan that you must know. Okay. So the screen that you're looking at here, this is our quote screen that we agents use to quote and do research for you. But what you need to look at here, whether you're doing it on a state-based exchange, whether you're doing it on healthcare.gov, or we're doing it for you on this platform, it's the same. The first thing that you've got to understand, and a lot of insureds put a ton of focus on the deductible. They forget the other parts. Their entire focus is on the deductible, and then they're in for a nasty financial surprise if they get hospitalized. So let's take a look at this one particular plan here. All right, so the deductible here in this case is 0, okay? We can look at some other scenarios. Here's a $500 deductible. Here's a $795 deductible, a $1,000 deductible. Well, let's look at the definition of a deductible. And I'll read it straight from here because it's perfect. An annual deductible is the amount your health plan requires you to pay for health care each year before your health plan benefits kick in. Before you meet this amount, you are required to pay full price or the designated before deductible amount is for healthcare. All right, so it works like a deductible on your auto insurance, on your home insurance. This is what you pay first. So you may look at this plan and think, well, I have a $0 deductible. I don't have to pay anything. And that is correct. Well, what about this plan where you have a $1,000 deductible? So I pay $1,000 and then I'm done? Because on auto insurance, once you meet your deductible, the insurance carrier takes care of everything else. That does not work here with health insurance. Okay, there are 2 other parts that you have to concern yourself with. All right, so now that you've got the basics of what a healthcare deductible is, the next section is the out-of-pocket maximum. Okay, the out-of-pocket maximum is the amount, an out-of-pocket maximum is the most that you have to pay within a year for your healthcare services. Once you've reached the out-of-pocket maximum, your plan begins to pay 100% of the allowed amounts for covered in-network essential health benefits. Costs that go towards meeting this out-of-pocket are your deductibles, your co-insurance, and co-payments and other similar charges. All right. So I'm going to break it down here. You have your deductible and you have your out-of-pocket max. This deductible, whatever this amount is, goes towards meeting that number. In this case, 0 of it does. But in the case of $1,000, with this 1,000 goes into that amount. Okay, I'm going to use this here as a representation. Forget the carrier name, forget the plan, metal level, forget everything. Okay, now, the other thing that goes into play with the deductible and the out-of-pocket max is your co-insurance. You've got to know what your co-insurance is. Now you notice here it says 30%. I can kind of guess that maybe it's at 30%, but let's figure this out. So I'm going to click on this, and this every agent should be giving you this. And I'm going to scroll down here and I'm going to take a look and see what my co-insurance is for most services. So I see here 30%. I see here for imaging 30%, but if it's done somewhere else, 20. Let's go to the hospital. Okay, if you're hospitalized, I'm seeing in this scenario a 30% coinsurance. All right, so I'm pretty good to assume that the coinsurance for this plan is 30%. All right, and now I'm going to explain to you. I'm going to draw this out. My handwriting's, I'm writing on a little electronic pad. I'm going to do the best that I can to explain to you how the deductible, the coinsurance, and the maximum out-of-pocket work. First thing we're going to do is let's go back here and let's look at the variables. I'm going to use this one right here, $1,000 deductible, a coinsurance of 30%, and an out-of-pocket maximum of $94.50. All right. All right, so I'm going to write these numbers down over here. So we have $1,000 deductible. We have a 30% co-insurance, and we have a $9,450 maximum out of pocket. Okay, so this is your plan. These are your variables for that one specific plan. Now let's go take a look. Here's what I see, guys. I see a lot of people focusing on 1,000, and most insureds forget to go look at the maximum out of pocket. So this is how it works. Let's say that, and we're going to do two different ones. Let's say you go to the emergency room and your bill is $5,000. Okay, that's probably a couple of hours in the emergency room. And then let's look at another scenario where maybe your bill is 100,000. Maybe you spent a couple of nights and they did some procedures on it. So let's do the small bill first. All right, you know that you have a $1,000 deductible. So we're going to take the 5,000 and we're going to subtract the 1,000 that you paid. Okay, that's going to leave $4,000. So this you had to pay. Okay, now coinsurance means you're going to split the remaining portion of the bill by whatever this number is. So if this is 30% here, that means this has to be 30%. So what this means is that you pay 30% of the bill. The insurance company pays 70% of the bill. Okay, so 30% of 4,000 is 1,200. Okay, so your total spend for this one $5,000 procedure would be the $1,000 and the $1,200. Okay, so you're out $2,200 for this procedure. If throughout the year you added more procedures, you would keep paying 30%, 30%, 30% until you reach a total of $9,450. The deductible is an annual deductible. Okay, so one thing that you have to do is when you're determining that maximum out of pocket, know that whatever your deductible is, it is built into the maximum out of pocket. All right, now let's do the $100,000 bill. So you have your $100,000 bill, and then you pay the $1,000. This is your deductible. So you pay that. That leaves $99,000 left over. Then we do your split. Okay, you pay 30%. The insurance company pays 70%. Okay, you carrier. All right, so 30% is, do this right, 99,000 times 30%. Okay, so if I just do straight math, 99 times 30%, I come out to 29,700. Most people would have a heart attack. Like, what's going on? I have to pay 29,700 plus my $1,000? And the answer is no. Remember, the maximum out of pocket is the most that you would pay in a year. So this is what happens. Remember, you have to pay $94.50 in a year. You already paid $1,000, which was your deductible. That leaves $84.50. So you would have to pay $8,450. And then after you've paid that, remember the 1,000 and the 84.50 equal 94.50, which is your maximum out of pocket. After you've paid that, then what happens is the plan switches to 0% for you and 100% for the insurance carrier. Okay, so after you pay this 84.50, even though 30% of 99,000 is 29,700, you are done for the remainder of that calendar year. Okay, so be aware of that, guys. So a lot of times what I do is I tell insureds, quit focusing so much on the deductible. Yes, it matters, but in the grand scheme of things, if something were to happen to you, what matters the most is going to be your maximum out of pocket. So now you know three things of the four, three parts: the deductible, the coinsurance, and the maximum out of pocket. The fourth thing that you have to be aware of is your plan has copays. Okay, so let's look at the copays. Let's go back to this plan. So when you go see a doctor, you have a no charge copay, a $0 copay. Maybe with a different carrier, you'll see $15. If you see copays, you're going to pay the copays, not the deductible and not the coinsurance. Okay. So if, for example, you took this plan, well, you would pay $15 for that doctor visit. If you went to go see a specialist, you would pay $35. If you had generic drugs, you would pay $15. These amounts that you see here, when you're paying those out, they are added to the maximum out of pocket that you have to pay. So if you saw the doctor 10 times, that's $150 that will get reduced from this maximum out of pocket. They do not go towards your deductible. They go towards the maximum out of pocket. Your generic drugs, they also have copays. So copays are good, but here's the other thing. Make sure that you're paying attention to detail, because look at this plan right here. If you went to go see a specialist, you might be thinking, I'm going to spend 30%. Well, that specialist is $300. I'll pay $90. I'm good. You're going to get a financial surprise. Look what it says here, 30% after you've met the deductible. Well, now you get a bill for $300 and you're not too happy. You've got to pay attention to the details of the plan. So the four basic parts: deductible, coinsurance, maximum out of pocket, and then your copays. If you know those four things of the plan that you're considering, you're going to have a very good understanding of the plan that you might select. Now, in order for you to have an accurate quote, there's information that either you need to enter correctly or that we as agents need to gather for you so that we're running accurate quotes. So I'm going to share with you my intake form. When I meet with an insured, this is the data that I must collect in order to write or in order to quote an accurate plan. So this is what you will need. So you need the name of everybody that's in your tax household. This is where the majority of insureds make huge errors. And it may not impact you immediately, but it will definitely impact you when you file your taxes. And you're going to be in for one heck of a surprise financially if you don't do this right. So it is important that you gather all the information, or that you give the agent that you want to work with all the information on your tax household. What I mean by tax household versus the actual household, what I'm referring to is in your house, you may live, it may be, I'm just going to throw it out there. Let's just say it's me, my wife, and my 3 kids. I'm a household of 5. But my sister may live with me, and she lives in the house. But when I file my taxes, I only file taxes for me, my wife, and my 3 kids. Not my sister. My sister may file her own taxes. She lives in the same house. So the question is, do I include her or do I not include her? Okay, it matters. So technically, what actually should be on that application is everybody who's in your tax household. Okay, it does not matter if they want insurance coverage or not. Okay, I get the response. Well, but I don't want to insure. Let's just say it's a husband and wife. Husband has workplace insurance, or maybe husband has Medicare. I don't want to insure him. Perfect. We don't need to insure him, but we need to put that person on the application because that is part of the tax household. Or vice versa. Let's just say it's 2 people who live together, common law marriage maybe, and you refer to each other as husband and wife, but yet they file taxes separately. I may file single, the other person files single. Then technically, we're not in the same household in reference to this ACA Obamacare application that we're doing. So I hope that makes sense for you guys. So you would give the agent, or when you enter the data, make sure you're entering all the people here. So I'll use me as an example. Me, wife, and 3 kids. We are a household of 5. Okay, so I would put my name, wife's name, and the 3 kids' names. Then I need date of birth for all 3 of them. Okay, I need socials for all 5 of us. Okay, citizenship depends on where you live. Depends if you must have legal residence. Okay, you must be legally here. So if you're a permanent resident, if you have a work visa, there's a whole list of legal immigration statuses that will allow you to get an ACA plan with assistance if you qualify. Okay, so you need to know if you're a citizen or not. And if you're not, then what's your legal immigration status? What is it? Is it you're a permanent resident or any other status? Okay, then CHIP or Medicaid. So if I'm not going to insure somebody, or I want to know, is it because they have Medicaid? Is it because they have CHIP? Or maybe they have Medicare, or maybe they have workplace insurance. Okay. Then we need to know your phone number, of course, your email, and your address along with your county. We must have that. Then we need to have your employer, and we need to have your spouse's employer. It is important that we have that. So I need everybody's employer. If maybe one of your kids works and you're claiming them on your tax return, then you must have that employer information too. When it comes down to income, it is the total household income for everybody that's in or on that return. So if you work, your spouse works, out of the 3 kids, maybe 1 works, you need to take all 3 of them and add that income. The question that I get quite a bit, is it gross income, or is it adjusted gross, or is it net? Kind of depends. But however you figure out your taxes, but the number that we use is the adjusted gross income. I think it's line item number 11 on your tax return. If you're self-employed, it's your gross minus your expenses. And there's some other stuff in there. But best thing to do is ask your financial preparer to give you that AGI so that you're quoting this thing accurately. So in addition to the income that must be that must be submitted or that you must know of. You need to know, or we agents, in order for us to do a good job, and also for you need to write down the list of all of your prescriptions, as well as all of your doctors, your specialists, any facilities that you go to, maybe the pharmacy, maybe you're doing some therapy at this facility. You need all that information so that quotes are run accurately. So if you don't have that information, you could enroll into a plan that maybe doesn't cover your doctor, maybe doesn't cover the facility where you're getting treatment at, maybe your pharmacy is not a network, maybe those prescriptions that you have are not covered. So there's a lot of information that we need to run good, accurate quotes for you. Now we're going to talk about the different metal levels. There are 4 metal levels that most people deal with, and that is going to be bronze, expanded bronze, silver, and gold. Okay. Now, these are just, I'll share with you what they mean, but then there's, depending on your income and the size of your household, there's some variances of this, but let's just go with this for right now. Okay. So depending on your plan, so if you have a bronze plan, typically what it means is that you pay about 40% and the insurance company pays 60%. Then when you move up to a silver plan, premiums technically start increasing. You pay less, you pay 30, and the carrier pays 70. And then you get to gold plans, which can be technically more expensive. You pay less for your medical services, 20%, and then the insurance company pays 80%. All right. So you're shifting more responsibility to the insurance company. Therefore, you're required to pay more of a premium. Now, let me show you what this really means when we're talking about quotes. All right. So I'm going to go in here and I'm going to just put $100,000, and then I'm going to change this up a little bit. All right. And we're going to try to make this easy. I'm going to focus on just one carrier, so we stay with the same company. So this is a bronze plan. Okay. Some companies don't have, they have no bronze plans, but they do have an expanded bronze. Okay. So let's just take a look at a bronze plan here. And then I'm going to go in here and I'm going to attach a silver. Let's find a silver plan here with Blue Cross. Okay. And then I'm going to go find a gold plan. All right. So we got 3 plans side by side. So now what I'm going to do is, now it's a little easier to do some comparison. All right. Now we have the bronze here on the left, silver on the right or in the middle, and then gold on the far right. Look at the premiums. Okay. The premium for the bronze is $307. Then for the blue, it's $448. But for the gold, is a little cheaper. Again, there's always some exceptions to the rule. Now let's look at the deductibles. Remember, the deductible is what you have to pay first for your healthcare services. So with this one, you pay $7,400. With this one, you pay $5,900. And with this one, with the gold, you pay $1,000. Not bad. Now let's look at the maximum out of pocket. And you all know now that on the maximum out of pocket, this is the most that you will pay in a calendar year for medical services. It includes your deductibles and other co-payments that you make. Okay. And if we look at the screen here, I can't move my mouse, but you'll see it, that little box that's opening. The out-of-pocket maximum is the most you'll have to pay within a year for healthcare services. Once you've reached that, it pays 100%. Costs that go towards that out-of-pocket are going to be your deductibles, the co-insurance, and co-payments. Okay. So now let's look at this. The bronze plan, $9,450. The silver plan, $9,100. and the gold plan 94.50. So just based on those variables, what plan would you take? Me personally, if I wanted the least expensive, I'd pay the 307. Why spend another 70, a little under $70 to get this plan when my out-of-pocket maximum is the same, but my deductible was a lot lower. Okay, so in this scenario, maybe on a smaller charge like 5,000, I would definitely pay a lot less with the gold. But if I had a $100,000 bill, I'm going to pay the same amount. Okay, just food for thought. Now let's go look at the co-pays for the primary care doctor. So on the bronze it's 0, on the silver it's 40, on the gold it's 0. For a specialist, on the bronze it's 50% after the $7,400 deductible. Oh, that takes a bite out. That really hurts. So that pretty much what that means is you're going to consistently have to pay the full cost of that specialist. On the silver plan, you'd pay $80. Not bad. And on the gold plan, you would pay 30% after that deductible. Okay, that deductible again is $1,000. All right, let's go to generic drugs. On your generic drugs, you would pay 10 under the bronze, 20 for the silver, and then 5 for the gold plan. So just something to think about, guys. Sometimes bronze is not always the best. You got to look at all the variables. That's what we agents do. And there's more variables to look at, but that's just me comparing things on the top. Now, look at this. Depending on the income. All right, let's go drop this down to 20,000. Look at what happens now. When the income is low, there's 2 things that happen. And I'm going to explain them in detail, but I'm just going to give you an overview right now. 2 things that happen. The first thing that happens is you get a savings, a subsidy to help pay your premium. According to this plan right here, with this one household member at $20,000 of annual income, this person gets $451 a month in assistance to help pay for the premiums. Now, because the income also is that low, you also get cost sharing reductions. It's a little badge. And what this means is that it's going to reduce the co-payments, well, the deductible, the co-payments and the co-insurance, and the maximum out of pocket. But it only applies to silver plans, not to bronze and not to gold. So now let's go and compare. All right, now all of a sudden, all my plans are 0. Okay, well, if you just look without any details, without looking at all this stuff, and I gave you a choice, do you want something that's bronze, silver, or gold? You'd probably select gold because gold is worth more. Okay, but when we're talking about the world of healthcare, it doesn't work like that. Remember that I told you the cost sharing reductions, they only apply to the silver plan. All right, let's take a look now. So look at my deductible. Okay, $7,400 for the bronze, 0 for the silver, and $1,000 for the gold. Look at my maximum out of pocket. $9,400. This one's $1,800. Remember those cost sharing reductions, they reduce the amount. Okay, just on the surface here, I would be not too smart if I didn't choose a silver plan. Okay, look at the copays. Well, nothing really changed for these two. My doctor is now 0. My specialist is 10. The specialist was 80 before. Okay, my generic drugs, I think they were $5. Now they're free. They're no charge. So remember that cost sharing reductions only apply to silver plans. Now you may be thinking this, well, if that's happening, you've got to be taking something away. Maybe my coverages are not as good. Maybe the network is different. Maybe. Well, I'm going to tell you this, guys. The network is the same. We're talking about this one particular plan. The network is the same. Doesn't matter if you're in a bronze, if you're in a silver, or you're gold. The network of doctors, specialists, facilities is the same. Oh, but then there must be a change in the prescriptions. Maybe they don't cover a lot of prescriptions. The list of prescriptions, which is called the formulary, is the same for all of these three plans. Okay, it's nothing has changed except that some of the costs that you would normally pay got reduced because of the income that I changed. Okay, so again, if you're finding this a little confusing and you're like, wow, that's too much, that's what we are here for. We do this every single day. We love doing it. We know it like the back of our hand, and we want to help you. All right, let's talk about subsidies. What a subsidy is, it is the assistance that the government gives you to help lower your premiums. And all this is based on the total household income and the number of household members. And remember, we talked previously, the household members are really not the people who live in your actual house, but they are the people that are on your tax return. That's it. Okay. So you may have mom, dad, and a couple of kids, two kids. Well, that's a household of four. So I'm going to explain to you what a subsidy actually does to your premium. Okay. So I'm going to run an example of a 35-year-old female with, let's say she makes $100,000. Okay. And we're going to focus just on silver plans. Okay. And let's go here. Okay. So here's what I have done. So I ran 100,000 and you'll notice over here, probably no savings. And this is a quote. And it says here, continue to browse your plans that fit your needs and your budget. So at $100,000, we're going to go look at a silver plan. And you're going to see the premium. And we're just going to focus on this first plan so you can start seeing the differences. So on this example here, you see that the premium is $448.21. There are no subsidies. Another word that is used to explain what subsidies are is the acronym APTC, Advanced Premium Tax Credits. So again, this is the assistance that the government gives you based on your household size and your income to help lower the premiums. All right, so let's take this thing down to 50. Okay, at 50,000, now you see that this person here has $156 of subsidies or savings. Now look at what happens to the premium. The premium now is reduced from $448 to $292 in change. Okay, now we start lowering this. Let's go to maybe 40,000. Get a little more help. Look at the premium. Now it's dropped to 163. Let's go to 30,000. At 30,000, a little more help. Now, $53 in change. Not bad. Okay, let's go to 20,000. At 20,000, premium, the subsidy is $451. The premium now is $0. Beautiful. So you may be thinking, well, I'm just going to put the lowest income and see if I don't have to pay $0 on my health plan. Well, you can't really do that. Here's what's going to happen if you underreport, if you overreport, or if you're just completely off on your income. So at tax time, you're going to receive a form that's called a 1095. This form is what your tax preparer, your accountant, your CPA, whoever's doing your taxes is going to need to complete your tax return. And what's going to happen there, it's going to indicate on that form how much help you got every single month. Now, when you get the taxes done, you're going to get your final adjusted gross income, the exact number that should have been there. And here's what happens at tax time. If we use this number, so for example, let's go back to this 20,000. Let's just say you put $20,000 as your income, and that's what you thought you were going to be at. Well, you're getting $451 a month in assistance. Okay, so let's do the math here. 451 times 12 is $5,412. Okay, so let's say this is your income, and this is the $5,412 that you got. If for some reason you finish higher, let's say that you were at 30,000. Well, you should have only got $395. Okay, so now let's do the math. 395 times 12 is $4,740 minus the 5412. That's a $672 difference. So what would happen at tax time, you'd have to pay that money back. And you're like, well, $600 is not very much. Let's just say you finished off at 100,000. Well, at 100,000, you should have got no help, but you put 20. So now what's going to happen is you're going to have to pay the 451 times 12, which is $5,400 and change. You're going to have to pay all that back. Okay. And the reverse is true. Let's say that you put 100 and you got no help, but you finished off the year a little lower than what you expected. Let's say that you expected to you expected to be 100, okay, but you finished off at 50. Well, at 50, they should have given you $156 a month. 156 times 12, that's 1,872. So now you have a credit because you should have gotten that much help every single month. My best advice to you all is do this. Report the most accurate income that you have. And whatever subsidies you get, and that's what you roll with. Now, you must report changes. Let's say that you have an income change. You get a better job or you should get a bonus, you start making more money. Okay, whatever it may be, whether you make more or you make less, if you do not want to have a surprise at tax time, the best thing that you can do is report a change, report on that income change, and then deal with the results. Okay, that way you don't have any surprises. And if you're like, well, I don't care, I'll be okay if I get a surprise, I just don't want to mess with my monthly payments, well, then don't report it. But then you have to handle it at tax time. So we just discussed the advanced premium tax credit, the subsidies that one individual may be able to get depending on the size of their household and also household income. And again, subsidies decrease the premium. But there is also another form of assistance that you get, and that is called cost sharing reductions, CSRs. Now I'm going to share what those are. And also to qualify for those cost sharing reductions, it is based on the household size and it is based on the household income. All right, so this is the best way that I can think to illustrate what CSRs are. So I'm going to take the income from 50,000. I'm going to lower it to 20,000. You will see here that now in this section, you are getting what's called cost sharing reductions. What this does is it lowers the deductible, the co-insurance, and the maximum out of pocket. But it only applies to silver plans. It does not apply to any other plan, not to bronze, expanded bronze, or gold. Only to silver plans. Here's where I see the majority of clients making mistakes. There's a bronze plan that is zero. There's a silver plan that is zero. And for some reason, they still choose the bronze, even though the silver has all the cost sharing reductions. So I'll explain that here in a minute to you. Okay, so let's go take a look at this. So the income lowered. Okay, let's just say it's this 35-year-old female. She's making $20,000 a year. You see now here that she's got cost sharing reductions. What happens here? Now, we already know that there's savings or subsidies that are going to get applied to the premium. So subsidies were applied, and that's why she has a $0 premium. But look what happens to the deductible. Look at what happens to the maximum out of pocket. It's been reduced. Okay, so let's do this. Let's go back to 50,000. Now you see here, look at the deductible. It's $5,900. Okay, look at the maximum out of pocket. It's $9,100. Look at the copays, $40 for a doctor, $80 for a specialist. Okay, now I'm going to put this into a compare and I'll illustrate something here for you in a minute. All right, now take her income down to 20,000. Now she's got CSRs or cost sharing reductions. And now the deductible's been reduced. The out-of-pocket has been reduced. And look at what happened to the copays. They've also been reduced. Well, I take it back. It's doing this one right here. I'm looking at the wrong plan. I apologize. So again, a reduction in the deductible, a reduction in the out-of-pocket, no charge for doctors, no, and specialists are $10. Everything has decreased. Now let's take this plan and let's compare it to a bronze plan. Okay. And let's also go ahead and get in here and let's compare it to a gold plan. Okay, now I got them side by side. Let's make sure we're doing this right. You know what? It did not. Let me get back out of here and we're going to put them into a better order. All right, so we're going to stick with Blue Cross. Okay, so let's pick this bronze. We will pick this silver. And then we will pick this gold plan. All right. So this will illustrate this a little bit better for you. So here's the bronze, here's the silver, here's the gold. Okay, and you notice that all of them have a premium of 0. So what a lot of people do, and this is natural, you think, well, I'm going to choose gold. Gold is obviously better than silver or bronze. Okay, that makes a lot of sense. But remember about the cost sharing reductions and how they were added to only the silver plans. Okay, so they're only applied here. So let's take a look at some of the numbers. Look at the deductible numbers. The deductible on the bronze is $5,500, on the silver it's 0, and on the gold is 1,000. The silver wins. How about the maximum out of pocket? This is your worst case scenario. Look at what happens here. On the bronze, $9,450, on the silver, $1,800, and on the gold, $9,450. Again, the silver wins. That's not even close, not even a competition here. Let's look at the copays for a primary doctor and a specialist. Again, you'll notice here how the silver wins. Okay, so in a scenario like this, it is always best, if you're going to get cost sharing reductions, you need to choose a silver plan. It's to your benefit. There are no differences between in the network or formulary between the bronze, the silver, and the gold. So the silver, again, is going to make so much sense. It's just a better choice when you're getting cost sharing reductions. What I want to share here with you next is the 2023 federal poverty level chart that we use as agents, and it may be very helpful to you. For business that, or for insurance policies that are going to be written in 2024, the 2023 federal poverty level chart is what's used. And when you're looking at this, this thing looks very, very busy, but I'm showing this so you can have an understanding of how things work. So let's say that you are a household of one. Well, at a household of one, 100% of the federal poverty level is $14,580. Now, here's what happens. Let's assume that you're only going to make $14,000. Okay. In some states, Medicaid was expanded. Also, the amount of cover, the amount of people that qualify for Medicaid was also expanded. So if you're in one of those states where that has happened, and I believe Illinois is one of them. Okay, there's several. If you're at 138% or less, you qualify for Medicaid. I'm here in Texas, and in Texas, if you make under 100%, you don't qualify for anything. Texas did not expand Medicaid. So those people with making very, very low income, they're completely out of luck and have no options. They get no assistance. So anything, let's assume that you're not in a state where Medicaid was expanded. Here's what happens. If you are under 100%, you end up paying the full price for the plan. You get no subsidies and you get no cost sharing reductions. As your income moves to the right, as you make more money, what happens is you get less and less subsidies. And at some point, cost sharing reductions are phased out. So I'm going to explain that. So let's go take a look at my quote here. Okay, going back to this quote, let's go back to this 20-year-old, $20,000 person. Okay, if I put 14,000, here's what happens. Your income is too low to receive any kind of help from the government. Okay, now this person has to pay the entire premium for the plan. Okay, if we bump up the income to 14,900, a little bit above the limit, all of a sudden now there are savings and there are cost sharing reductions. So if you finished the previous year at 14,000, but you think the current year where you're getting your insurance, you could make the 14,900, then definitely don't put last year's numbers. Put down what you think you're going to make this year in 2024 or whatever year you're applying. Okay. And you'll also notice that as the income increases, you will see, okay, still the same there. Let's say we go to 30,000. You'll start seeing as your income moves to the right on that federal poverty chart, your subsidies or savings that you're getting is getting lower and lower and lower. And then eventually you get to a point, there's 40,000, there's 50,000, and then there's 60,000. And you kind of see, you get to a point where eventually you're going to phase out those subsidies that you're going to get. So at 60,000, you get $26. At 70,000, you've kind of fallen off the chart. It's a cliff. You've fallen off the cliff, and now you're getting no subsidies, no CSRs, and you're having to pay the full premium. One question that I get quite a bit from insureds is, if I choose a bronze plan, a silver plan, or a gold plan, can you tell me exactly what it covers and what it doesn't cover? So I'm going to share with you on this next screen here what is covered under the health plan. And there's 10 essential health benefits that these plans must cover. And that's what I'm going to share with you next. So here on healthcare.gov, I went and entered this information and what marketplace health insurance plans cover. There are 10 essential health benefits. So the first one is ambulatory patient services, outpatient care you get without being admitted to the hospital. Emergency services, hospitalizations like surgery and overnight stays, pregnancy, maternity, and newborn care, both before and after birth. Mental health and substance use disorder services, including behavioral health treatment. This includes counseling and psychotherapy. Prescription drugs, rehabilitative and habilitative services and devices. Services and devices to help people with injuries, disabilities, or chronic conditions gain or recover mental and physical skills. Lab services, preventive and wellness services, and chronic disease management. Pediatric services, including oral and vision care, but adult dental and vision care aren't essential health benefits. And I will tell you this, usually 99% of the time, these plans do not cover any adult dental and vision. And in fact, the pediatric services, the pediatric oral and vision is pretty poor. Network, I always have trouble finding a network of doctors for these two services. Now, additional benefits. Plans must also include the following benefits. They must include birth control and breastfeeding coverage. Okay. Now that you know what's covered, what is not covered. Okay. What I'm going to do here is I'm going to pull up a summary of benefits from one of the plans. So let's go and we're going to focus. And let's just pull any summary of benefits. Okay. When you are enrolling or if you're working with an agent, they should provide you the summary of benefits. It's in the format of a question, the answer, and then an explanation. So I love these. Okay. Now, it'll explain what the deductible is for you. It will explain, are there services covered before you meet the deductible? Are there any other deductibles for specific coverages? It goes on. It'll also ask you, it will let you know if you need referrals to see a specialist. So it's a good document that you must retain. Now, let's get to the section here of services that are excluded from your plan. Okay, abortion is not covered. Acupuncture, bariatric surgery, cosmetic surgery, dental care for adult, and now this one is excluding children also. Infertility treatment, long-term care, non-emergency care while traveling outside the US, private duty nursing, unless it's medically necessary, routine eye care, not covered for adults, routine foot care, unless it's medically necessary, and weight loss programs. So now you've got an idea of what's covered and what's not covered. Okay, so now you should have a great understanding of Obamacare, ACA plans. The next challenge for most insureds is the enrollment guidelines. When can you enroll? So the biggest one we're going to talk about right now is open enrollment. Okay, open enrollment starts November the 1st and it ends January the 15th. During that time frame, and this is a national enrollment period, during that time frame from November the 1st to January the 15th, people can select a plan if they don't have one. And if you have a plan, you can make changes. This is a season that most of us agents do the majority of our business. Now, if for some reason you missed out on that enrollment season, you are not completely out of luck. Okay. Anything outside of the January 15th date falls under what's called a special enrollment period. Now, there are several things that we consider that will qualify you for a special enrollment. And I'm going to get into the specifics of that. Number one is a special enrollment period due to a life change. I'm going to share all those different life changes that are available to people. The other special enrollment period that is huge is going to be the loss of Medicaid and CHIP. CHIP is the Children's Health Insurance Program. Across the country right now, what's happening is they're actually it's a huge crisis. There was during the pandemic, there was a guideline that was passed that anybody who had Medicaid or CHIP did not have to requalify. That lasted for 3 years. Now, in mid to late 2023, that phased out, and now people have to requalify for Medicaid or CHIP. If you don't reapply, they kick you out. If your income went up, they kick you out. So what's happening is across the country, and it's supposed to last all of 2024, millions of people are losing Medicaid or CHIP. If this has happened to you, you have a window now to utilize this special election to get a marketplace ACA Obamacare plan. And then the third is you may qualify based on your income. So if your income is between the 100 and the 150% mark, or if you're in a state where Medicaid was expanded, it's from 138 to 150. if you're within that income range, you will qualify for a special enrollment. And we call that the low income special enrollment. Now, let's talk about the different life changes that will qualify for this kind of special enrollment. So let's say that you have a change in job status or a change in income. Okay. So that right there, anytime you have a change in your employment or income, report it, even if you don't think the change will impact your coverage or savings. So sometimes if you lose your job, you're also going to lose your health care. This will allow you to get into a plan. Gain or loss of health coverage. You lose health coverage, you've got the ability to get into a plan. But it must be done within the last 60 days of you losing that coverage. If you exceed that window, then you lose the opportunity to utilize this special election. Okay, sometimes if you've got kids under your plan and they're turning 26, they get kicked out of the parents' plan. Maybe you're losing coverage due to getting a divorce. Okay, sometimes that happens. So here are the list. So divorce, turning 26, maybe losing Medicaid or CHIP. We already know that that's a special election. COBRA's ending, school coverage is ending, or maybe you just moved out of the area where you have insurance. For whatever the reason is, loss of health coverage will get you into a plan. Gain or loss of a household member. Any change in members of your household can affect how we count family size, which makes a difference in how much help you and your family get. If you're adding a dependent, okay, or you're adopting, this will affect positively or negative, we don't know, but it will create a special election. Okay, change in family relationships, a move out of state, pregnancy, change of student status, tax filing status, citizenship or immigration status. If you weren't here legally and all of a sudden now you're gaining your permanent resident card, well, that will allow you to get into the plan. Incarceration. If you were incarcerated and you're now released, you now have a special enrollment to get in. So there are lots of options, lots of life changes that may qualify you to get a special election. So make sure that if you're applying for coverage, that you are aware of that. Otherwise, you may not be able to enroll, and the system will tell you that you have to wait till open enrollment. Again, this is why we agents are very valuable to you. So if you're having some trouble with this, don't be afraid to work with an agent. We do this day in, day out, and we'll help find a special election for you so that you can enroll outside of the regular open enrollment season, which is November the 1st to January the 15th. One question that I get quite often from my insureds is preventative care covered? And if it is covered, can you tell me what I will have to pay for preventative care? I'm going to answer that question right now. Okay, so preventative care. Most health plans must cover a set of preventative services like shots and screening tests at no cost to you. So that's a good thing. One thing that is super important to know is that whatever plan you decide to get on, you must get these preventative services from a doctor that's inside that network. If you go outside of the network, you are completely out of luck. Now, I'm going to share with you what the preventative services are for all adults, for women, and then for children. So here is a list of the preventative care for adults. Now, it does not matter what plan you have. They're all going to have this, and they're going to be provided to you without charging you a copay or coinsurance. This also applies if you have not met your deductible. So, abdominal aortic aneurysm one-time screening, alcohol misuse screening and counseling, aspirin use, blood pressure screening, cholesterol screening, colorectal cancer screening, depression screening, diabetes type 2 screening, diet counseling, fall prevention, hepatitis B screening, hepatitis C screening, HIV screening, the PrEP pre-exposure prophylaxis, HIV prevention medication, immunizations for adults, and there's a list of them, lung cancer screening, obesity screening, sexually transmitted infection prevention counseling, statin prevention medication, syphilis screening, tobacco use screening, and TB screening. So those are the screenings that are available for all adults. For women, these are specific for women who pregnant or who may become pregnant, breastfeeding support and counseling, birth control, folic acid supplements, gestational diabetes screening, gonorrhea screening, hepatitis B screening, maternal depression screening for mothers at well baby visits. Oh, I can't even pronounce it. Pre-eclampsia prevention and screening, RH compatibility screening, syphilis screening, expanded tobacco intervention and counseling, urinary tract and other infections, and other covered preventive service for women age over 65, bone density, breast cancer, cervical cancer screening, and there is the entire list for women over 65. Now we'll get into the screenings that are, or the preventative care that is covered for children. What you're going to see here is alcohol, tobacco, and drug use assessment, autism screening, behavioral assessment for children, bilirubin concentration screening, blood pressure screening, and so on. Immunizations, you got the chickenpox, diphtheria, tetanus, I'm sorry, DTAP. It's getting very specific on these immunizations, but these immunizations are covered for children. Lead screening, obesity screening. Boy, there's a lot of screenings that are available for everyone, for adults, for women over 65, and children. And remember, they are offered to you at no cost before the deductible, and there's no copayment and there's no coinsurance. I also get some additional questions regarding pre-existing conditions and the limit of insurance that an ACA plan covers. So I'm going to discuss that next. When it comes to pre-existing conditions, what you need to know is that all marketplace plans must cover pre-existing medical conditions. No insurance plan can reject you. They can't charge you more, and they can't refuse any of your essential health benefits for any condition before the plan started. So you don't have to worry about it, guys. If you have a pre-existing condition, it's going to be covered with the new marketplace plans. Now, once you're enrolled, the plan cannot deny you coverage or raise your rates based on your health. Medicaid and CHIP also cannot refuse to cover you or charge you more because of a pre-existing condition. Now, the other question I get from young women is also pregnancy. Is pregnancy covered? And yes, pregnancy is covered immediately when your plan starts. Now, there are a few exceptions. This is kind of rare, but if you have an old grandfathered pre-Obamacare plan, and you can't get those anymore, but you're grandfathered into that plan because possibly it's a PPO or whatever it may be. When that plan ends or you decide to end it, you will have the ability to enroll in a marketplace plan. And also, you don't have to worry about any pre-existing conditions that you had while you were on that old grandfathered plan. So you're all good. Don't worry about it. You are fine. It's going to be covered. Now, the next issue that we have is the limit on the amount that the insurance company pays. And those limits have been completely removed. In the old plans that we had, the grandfather plans pre-Obamacare, you had limitations on the amount that they would pay per person per year. If you had a pre-existing condition and they covered it, you might have had a waiver where they would not cover that, or possibly only cover a percentage or an amount for that pre-existing condition. But those days are gone. Now, with these Obamacare, ACA, the Affordable Care Act plans, you don't have to worry about pre-existing conditions, and you do not have to worry about the limits on the amount of insurance that your plan has. Wow, that's a lot of information to try to grasp when it comes to ACA, Obamacare health insurance plans. What I'm going to do now is I'm going to run some sample quotes to give you an idea of what it looks like. Okay. All right. So I'm just going to run, maybe it's a young family, maybe a 40-year-old father, maybe he's got a younger 35-year-old wife, and maybe they've got two kids, maybe a 10-year-old girl and a 5-year-old boy. Okay. So I've entered their information, and it's a household of four. And let's say that this family makes about $80,000 a year. Okay. Based on this amount, they're going to get $1,214 in savings. Okay. That's the subsidies that we talked about before. Now, if their income was maybe a little lower, they could possibly qualify for savings. They could qualify for cost sharing reductions. Now, because the income is low in Texas, there's a possibility that the two kids may be eligible for CHIP. But let's just say that they're not. Okay, so now I've got my household of four. And now let's just kind of go look at some plans. Okay, just kind of see, you can see the complexities to this. All right, so let's go and let's focus on expanded bronze plans. And let's take a look. Let's say that we're very budget conscious. We want to make sure we get the lowest plan or not spend a lot of money. So as far in this county with the expanded bronze option, it looks like United Healthcare might be the least expensive, but you'll notice there's a lot of $0 plans. So which ones do you choose? Well, what I would do is I would make that selection based on the doctors that you see and the medications that you see. So what I did here, we have the ability to do this, and you will too. You can enter the doctors that you see. So maybe, I just picked a doctor's name here. I entered this doctor here in San Antonio. I put in one medication. Well, let's go put another medication. Let's say maybe that you're taking metformin for diabetes. Okay. Let's say you're taking just that one. Okay. We put a doctor here. Now what you can, you know what? I think I chose the wrong metformin. Let's go and edit this. So, and here's the other deal. You got to make sure that you choose the right medication and make sure that you get the right dosage. Okay, so you'll notice here that I had chosen a different metformin. It wasn't covered, and now this is your typical generic metformin. Okay, so now we've got some things that we got to look at. Okay, so now I'm seeing a lot of green. Doctors in the network, the medications are in the network, but I am doing a search based on whether the doctors are in network. Now, if I just go for the lowest premium, look at what happens. Okay, well, in this scenario, this is still a $0 plan. Doctors in network with United Healthcare, in network with Oscar. Oh, but look at this $0 plan. Not in network with this one. So if you select this one, you'll notice that doctor's not covered. Okay, now we're talking about bronze plans. Okay, what if we go look at silver plans? Well, let's just do a comparison. Let's just say we're going to stick with United. You're liking everything about United. So I'm going to choose this plan. Now I'm going to get out of the bronze and I'm going to go to the silver. Okay. Well, now when it comes over here, now the least expensive silver plan is Blue Cross, but my doctor's not in here. So I'm just going to keep scrolling. Okay, so we might choose this one here. And let's go look at a gold plan. Get in here. and maybe we look at this gold plan. So we've got 3 plans. The doctor's in the plan and the medications are covered. Let's put them on a side by side. Now, looking at this scenario, I've got my bronze plan at a $0 premium. I've got my United here with a $131 premium on the silver one. And then I've got the gold plan over here with a $0 premium with on this gold plan. So you got to do some comparisons here. It's literally about running the numbers. Okay. If this person had a pending procedure, or they're constantly, they got some health conditions that constantly requires a lot of medical services, then what I would probably do, it might be worth to get this United Healthcare Silver Plan and pay the $131. And the reason why is look at their maximum out of pocket. It's $2,800. It's way lower than these $9,000 out of pockets over here. So I'd probably recommend the silver plan for this insured. Now, if this insured is super healthy, no major health conditions, they really just want the protection, then I may look at either the bronze or the gold. Okay, differences here. Let's look at the copays. Well, on the bronze, the doctor is $40, the specialist is $120. On the gold plan, the bronze, the primary doctor is $0 and the specialist is $60. I'm probably going to lean more towards the gold plan in the scenario for that person who is super healthy and it just wants this for protection. They're not needing a lot of medical services. I'd probably go with this one instead of this plan. So it varies person to person. So the work that you must do, guys, is you must decide, or you enter your data, make sure you enter accurate data. You want to make sure that you're checking each plan. You're entering the doctors, you're entering the medications, and you want to make sure that those doctors and medications are covered, unless you want to switch to a different doctor or get different medications, which creates a whole other set of issues and more work for you. So those are some sample scenarios that I ran there for you. It's not that complicated, but here is what I think you guys should do. Now, I want you to know that whether you go straight to the marketplace, you go to healthcare.gov, or you go to one of the state-based exchanges and you do it yourself, or you work with an agent like us or an agency like us, and we do the work for you, what you need to know is the rates are the same. You don't pay anything more for using an agent. So why wouldn't you want the help of a professional agent? We here at Simply Health love what we do. I've got a great team of individuals, fully licensed and capable of helping you out. And we would love to help you out and choose the right plan for you. We don't get incentivized from one carrier to the other. We're completely unbiased. We will not pigeonhole you into a certain plan. We're going to do all the research. We're going to gather that data from that intake sheet. We're going to ask you about you and your family. We're going to get all of your sensitive data. We're going to get your income information and make sure that we enter it right. And then we're going to ask you for your doctors, your spouse's doctors, your kids' docs, and we're going to get the list of medications that all of y'all are taking, and we're going to plug that in. And we're going to try to find you the best possible plan so that you have the least amount of disruption. Now, we do get compensated from the carriers. You don't have to compensate us. And again, know that whether you use us or not, you're going to pay the same premium whether we're involved or not. So why not get the help of a professional? Guys, I hope this was very helpful for you. What you can do is, if you want our help, all I want you to do is click on the get one-on-one assistance, and a calendar will pop up, and schedule an appointment with myself or one of my trusted advisors, and we will help you out. I can't wait to hear from you. I hope you click on that one-on-one help, and we're super excited to help you out. Thank you.